Good day, everyone. This is Dr. Bill Clearfield. I am the Executive Director of the American Osteopathic Society of Rheumatic Diseases, and this will be our session on rapid auricular therapy for acute anxiety and pain reduction. And we'll throw in a couple of other entities for you also known as battlefield acupuncture. I have no disclosures and no financial interest in any of the materials or entities that we will be discussing. So, a brief discussion on the theories of acupuncture throughout the ages, especially for those of you who are not familiar with it. And of course, in the medical world, we were told it does not work, period. So let's see if we can interpret what our ancient elders or betters were trying to tell us in modern language, and we'll show you some truly amazing techniques that can be done quite quickly. It can be learned quite quickly with just a minimal amount of understanding and training. So modern or traditional Chinese medicine came from the Chinese theory of Tao, or the Taoism, Tao being the sort of the creator, or they called it the one. We may call it God or Lord or whatever your higher being is. And the Tao gave way to light and dark, right and left, male and female, any paired element or object, and they called it yin and yang. In the world, each yin and each yang would break down into 5 different what they called elements, or what we call a database, and that could be seasons of the year, types of food, colors, clothing, time of the day, and there's even a 5-element diet, and the 5 elements are wood, fire, earth, metal, and water. And so there is a yang or right or left-sided fire, and there are fire points, there are water points, there are metal points, and there are foods, colors, times of the day. Those are we can get into them in another session in a little bit more detail. There was a meridian or energy balance theory that is quite popular. And then the biochemical models, these are the more modern day. We can measure changes, we can graph changes, we can x-ray changes in our patient's body with our modern laboratory studies, x-ray studies, MRIs. And so the first of these in the late 70s, when beta endorphin was discovered as the most powerful anti-inflammatory substance that we create naturally. And it was found that indeed acupuncture therapy after approximately 7 to 9 minutes will increase beta endorphin in the bloodstream quite extensively. There was also increased cerebral blood flow that was found on functional MRIs, and we found that pro-inflammatory substances are diminished with acupuncture treatment, and anti-inflammatory substances known as cytokines are increased with acupuncture treatment. Cytokines have been in the news lately with the pandemic, and especially interleukins 1 and 6. And as you can see here, acupuncture downregulates pro-inflammatory markers, interleukins 1B and interleukin 6, along with interleukin 2, 12, 17, interferon gamma, and tumor necrosis factor alpha. It also downregulates the neuropeptide substance P, neurokinin A, vasoactive intestinal peptide, bradykinin, and calcitonin gene-related peptide. It upregulates the cytokines interleukin 4 and 10, the anti-inflammatory cytokines. Why the ear? It's effective in relieving acute and chronic pain syndromes. It is readily available. There's no disrobing. Hence, it can be dispensed in the field or battlefield. It may be applied either as a standalone or as a whole body treatment. The innervation and vascular supply renders the external auricle as an excellent correspondence map of an inverted body. And scanning the ear with a probe or battery-operated resistance measuring device can identify zones that correspond to traumatized areas. In the modern era, it was first popularized by Dr. Paul Noget, a physician in France in the 1950s, and he observed that immigrants who were frequently seen by folk medicine folk medicine practitioners would scar various areas in the auricle corresponding to maladies. So this here, what they're showing you is an area in the lumbar, what would be the lumbar spine, and there would be a scar there, and the patients would claim a high rate of success. Just briefly, the innervation of the auricle, the auricular branch of cranial nerve 10 is here. The auricular temporal branch of the fifth cranial nerve is here, and the greater auricular nerve from C2, C3 innervates this area. So there's an extensive nerve intervention, and there's an extensive arterial blood supply to the external auricle also, the posterior auricular artery, the superficial temporal artery, and it's also served by the sympathetic plexus of the external carotid artery. Here is a schematic of an early inverted fetus. Here's the head, here's the spine, here is the legs here is the arm, and the internal organs are in the concha here. Further experimentation found areas for some specialty areas, including nerves and the brain. We'll go into those a little bit later. There are actually three different phases. This is the inverted fetus. This is considered the acute phase. It corresponds to more of just in the head. This has to do with degenerative diseases. When there's a lot of degenerative diseases, we'll find a correspondence in this area here, and chronic diseases, and you can see that there's sort of an organ shift. The homunculus or the inverted fetus concept can be seen in other areas of the body. This here is just in the bones of the hand. The head is here, the feet are here, the neck is here, and all of the internal organs along the way. Just start at the top of the head, go all the way down to the feet, and you can kind of palpate, either use a probe, you can use your finger, and find areas that are tender, and you will find they will correspond to maladies in your own body. So if you have a lumbar or cervical issue, you can poke along here, and you will find soreness in that area. We can use a little press tack, which is a little flat piece of tape with a little tiny needle, no medication in it. And we can use that, put that in there. We can do a probe. We can put an acupuncture needle in there to correspond to various areas of maladydom. You can do the whole hand, and this one we do quite extensively. When you hold your hands up, you're going to be looking at me. You're looking at my palm. This is considered the dorsal side. The back of the hand, this is the ventral side. When the dorsal side, the left hand, what you'll find is the feet or the legs correspond to the thumb and the finger. This would be the right thumb, right leg, left leg. On this hand, this thumb is the left leg. This pinky is the right leg. The arms and hands are the index finger and the ring finger. So this would be the right index finger, right arm, left arm. On this hand, left arm, right arm, and the spine is considered the middle finger. The head is at the tip, and so we can frequently feel around. So if you have a headache, especially in the apex, feel around with your nail, and you can find an area. You may find an area that's more tender or acutely sore than the rest, and we just hold that for 30 seconds, and occasionally we will get some relief. The internal organs are in the concha of the hand here. The thoracic or the lumbar spine and the sacrum is in the corresponding side on the dorsum of the hand. There's scalp acupuncture. This is a schematic for what's called Yamamoto's do scalp acupuncture. And there are areas of motor areas here, and there are sensory areas here, and there are correspondents for the thoracic cavity, the upper GI system, the reproductive system, and these are separate entities in themselves. The point is that there are many different correspondences that have been delineated over the years. So this is Air Force Colonel Richard Nimzel. One day in 1995, I had been doing acupuncture for 3 or 4 years. I remember it was a summer day. My children were 10 and 8 years old. We were attending our garden before I was going to work, and I get a phone call from an Air Force base in Maryland stating that Dr. Colonel Richard Nimzel wishes to speak to me. I, at the time, was the secretary of the American Academy of Medical Acupuncture. This is an disclosure, I had a deferral from military service, and so I wondered, okay, what did I do now? Well, it turned out that I had written a paper in the early 90s about cervical spine pain using the 5 elements, water and water points, putting out fire points, which is, as far as I know, still used today as part of the treatment for cervical radiculopathy. See how we match the modern terminology to the ancient terminology. Anyway, Dr. Nimzel wanted to come and sort of study my what I learned. So he came up and he spent some time with me. He is a very enthusiastic gentleman. He actually took over the acupuncture journal and turned it into something that was just from a little flyer into a respected medical journal. And he was the one who came up with what we now know as battlefield acupuncture. So I mention him because it's only right that he deserved credit for it. He's gotten many slings and arrows from various really know-nothing journals. And so, progress sometimes has to be made with some pain. For example, if you look in 2011, Forbes magazine labeled battlefield acupuncture the one quote-unquote quackery of the year. Not 4 years later, the Air Force was granted a $5.4 million grant to study it, and then it was so successful that they now train their medics in the field to perform this technique that we're going to be discussing. These are the needles. They are French design. There are 8 to a strip here, and this is the inserter. There's a little, this here is a little bit of a magnet if you need to draw the needle out, and the needle is really right in the tip. They're actually very tiny. There it is. It's got a little sharp edge to it, and it's got a round head. The needles will not go in you. You will not find a needle 20 years from now in you. The usual issue is that someone will pick at the needle and end up with a problem. But most of the time they will fall out. A lot of times they're so tiny you won't even find them. What can we use our auricular therapy for: acute and chronic pain syndromes, migraine headaches, PTSD, depression and anxiety, stress-induced apathy and insomnia, pre and post-operative pain, and strains, sprains, and sports injuries. And for me, number 7 is probably my most common use. Patient comes in, they were gardening and pulled their back out. And this is quite useful and quite a rapid way of decreasing pain without using medication, not using narcotics. We of course then go on to delineate what the issues are. I mean, certainly if there's a herniated disc or or something else, we don't want to leave it where it's at. But this is a great way of alleviating the patient's pain. Contraindications: for some reason, pregnancy, although we've actually treated pregnant patients without any issues. Bleeding disorders, obviously, for putting needles in someone who has a bleeding disorder, there's an issue. This number 3 is probably the most common reason we don't do it, is the patients are needle averse. And 4, a history of vasovagal response. And this happens extremely rarely with these little tiny needles. And if there's an infected site, of course, you don't want to put a needle in there. Here are the 5 points, and we will go through each one of them. And they have to go in a certain order. We're going to start with this one here called the cingulate gyrus. And it's right at this junction here. The thalamus is right below the antitragus. That's the second point. The third is called omega 2, and this is an allergy point, and it's usually somewhere along here. In this diagram, it's put here. But if you use a probe or an electrical stimulator, you will find the area that's most reactive, and that's where you're going to put the needle. So it's somewhere along here. It's not always here. Shen Men is in this groove here. That translates as spirit's gate, and that has to do with anxiety and depression. And point 0 is right here, and this is a balancing point. Now, we don't put all the needles in on one side and then go to the other side. We go from side to side. We start here, and we put in enough needles to alleviate the pain. Our goal is pain is absent or barely perceptible. Frequently, we only need to put in 1 or 2. Again, here's the order: the cingulate gyrus, the thalamus, omega 2, point 0, Shen Men. The cingulate gyrus is located right at the junction here. And we start at on the dominant hand side, and we put in the cingulate gyrus here. If this is a right-handed patient, and then we go to the cingulate gyrus on the left. Again, we do not put them all in on one side and then all in on the other. I have tried it. It's easier when I'm feeling lazy. We do not get nearly as good results. If you're going to ask why, the only answer I have is the same as if you remember from Fiddler on the Roof, when Tevye, the fiddler, was asked why when he sang Tradition, why they have those traditions. And if you'll recall what his answer was, I don't know. The cingulate gyrus, you needle the dominant hand side first, then we alternate sides. It's a sedation and relaxation point, and it greatly decreases anxiety and stress, and it also will help reduce blood pressure. The next point is the thalamus, and this is right below the antitragus, right here. And this is probably the most important point of each one of the 5. And if your patient will allow you to do only 1 or 2, I would go with this one. Again, some patients are needle adverse, and there is a little bit of a pop when you put these needles in. It's the master point for acute and chronic pain and auricular analgesia. It represents the whole diencephalon, and that includes the thalamus and the hypothalamus. So there will be hormonal issues that can be addressed by needling this point. It pre-amplifies signals are sent to the cerebral cortex. It eliminates background noise, and this is the highest level of the supraspinal gate control system. The second needle side of greatest pain first, we can do it that way. And it will treat these conditions, including neurasthenia, anxiety, schizophrenia, overexcitement, sweating, shock, swelling, hypertension, coronary disorders, Raynaud's phenomena, gastritis, constipation, liver disorders, gallbladder dysfunction. It strengthens the brain and calms the mind. Again, remember, this is mostly an acute type issue. Our goal is to lower pain, lower anxiety till we get our patient to where they need to get to for the underlying issues. Omega-2 is in the helix here. And like I said, even though it's depicted here, usually we use a probe or an electrical point finder, and whichever area is most sensitive that's where we'll put our needle. It reduces inflammatory reactions, especially to allergies, inflammatory issues, rheumatoid arthritis, asthma. It's a detox point, and it helps us excrete metabolic waste, and it will help alleviate anaphylaxis. Shen-men in the Concha here. Tranquilizes the mind, allows a harmonious connection to the spirit. It alleviates stress, pain, tension, anxiety, depression, insomnia, restlessness, and excessive sensitivity. It's a universal point for auricular acupuncture, along with the next point, point 0. It's used in drug and alcohol detoxification in the NADA program. And it's useful for inflammatory diseases, cough, fever, and hypertension. Point 0 is our last point. That's located right here. And it's the geometrical and physiological center of the auricle. It creates balance and homeostasis. It's said to be located where the umbilical cord rises to meet from the mother to fetus. In that corresponding point, it supports other auricular points, and it balances energies, hormones, and brain activity. Here are our points again in the schematic area: cingulate gyrus 1, thalamus 2, omega-3 3, omega-2 3, Shen-men point 0. Remember, if we're right hand dominant, we do cingulate gyrus here. That's our first needle that goes in. Cingulate gyrus on the left side. That's the second needle that goes in. Then you can go to thalamus on the left side, and then thalamus on the right side, and then keep altering. What we'll do is we'll put in our first needle on each side. We always want to be balanced. So if we put, when I say one needle, it's always technically 2, 1 on each side. And if we get good relief and there's barely no pain after 2 needles on each side, we can stop. The needles will fall out on their own in 3 to 5 days. When I lived on the East Coast, where it's more humid, they would last. They would come out sooner. On the West Coast, some of them stay in for up to a week. Here's another schematic of it. Here's a functional MRI showing a decreased activity after the auricle has been innervated. And here's a couple of others. Pain before acupuncture is in the red, and you can see that it's pretty much attenuated in the right. It's pain in the fingers on this side post acupuncture. Here's another one in the cerebellum. You can see acupuncture. There's pain here. The red is the more intense pain, and the yellow, you can see it's attenuated after therapy in the auricular therapy. Here is the frontal lobe, and again you can see attenuation of pain. We went from severe to mild to moderate to some of it gone. And this is after the needles are removed. This was a before and an after, and you can see a generalized improvement in the patient's condition as measured on the functional MRI. This was a pilot study using just the cingulate gyrus and thalamus versus non-acupuncture control, and there was a decreased pain score by 23%. Here's the reference for that. Here are a number of cases. 4 weeks sciatica, lower lumbar pain, initial pain score 10 out of 10, post pain score 1 out of 10, and that was after 3 days. These are outcomes without further intervention. Bursitis, 7 out of 10 to 0 out of 10. Elbow and leg pain, 7 out of 10 to 1 out of 10. TMJ, and as you can see, ones, there's a 1, 2, but in every one of these cases, you can see a massive decrease in pain perception. And it happens pretty much immediately. When the patients leave, we don't let them leave unless we see a large drop in pain scores. It doesn't hold. And for chronic pain, we can do this twice a week. We usually do it for 4 to 6 weeks. 80% response rate. The relief lasts 2 to 4 days. And then we can do it, like I said, twice a week for 2 to 4 weeks, then once a week for 1 to 3 weeks, then as needed. It's easy to teach. The needles are all sterilized. They cost about 50 cents a piece. So 10 needles, the whole treatment costs the practitioner $5 in materials. It doesn't take much to insert. You can do it in a hostile environment. No need to disrobe. And we get a pain reduction of 1 to 3 days. Here's a picture of putting a needle in. That's 0.0 there. This is your Shen Min here. Here's your omega-3 or omega-2 area. Here's your cingulate gyrus. Here's your thalamus. Remember, 1, cingulate gyrus, 2, 3, 4, 5. There's a picture of the whole needle. Here's the needle. Here's the inserter. This is, I used to give the patients this magnet. It's actually quite, if it's irritating, it's actually easier if they either themselves or have someone take a little tweezers and just pluck it. If you just pluck it, it'll come right out. Remember, we still need to know what's going on. Don't treat undiagnosed pain. This is nice as a relief until we can get the patient either to the facilities that they need, or we begin our own workup. This is not, quote unquote, a cure of your pain. Again, appropriate selection of patients, obtain, there's an informed consent. We use an alcohol wipe just to clean the ears. We wash, of course. The patient is usually sitting on an exam table so that we're eye level with them. If there are any advanced techniques that need to be done, we will do them. We will talk about a few of those in just a few minutes. Usually we put in our 1 needle or 2 needles, so our cingulate gyrus and thalamus, and then we have the patient stand up and try to emulate the pain to see if it's been relieved. And then we stop and repeat until we get the result that we're looking for. Aftercare, tell the patients to please just leave the needles alone. Don't bother them. If they're very irritating, have someone take a tweezers and pluck them out. Don't rub them. Don't pull on them. And, you need to be careful with children and cats. Cats seem to like to scratch at it. You can use a point stimulator, an electrical stimulator like this one. This costs about $50. Has a battery, and the points will light up that are affected. Or you can use just a metal probe. You can even use just a finger or a fingernail. Any type of blunt instrument will work also. Okay, so if you get an inadequate response, what do we do? Make sure you do the whole sequence bilaterally in the order that we told you to. Then we can add in some silver needles to balance the gold ones. All the ones that we use are gold, and then we can do clusters and keep adding until we get a 2-point drop in pain scale. Okay, and here's a cluster. So here was our original. That's your omega 2, and then we added 3 silver needles to balance it. Here's our Singulate Gyrus. Here's your Thalamus. And I've actually never put in more than 2. I've never put in this many. I've never needed to. Here's another cluster plate placement. You can put it around, the silver one's around the gold one. So let's, a couple of specialty areas, migraine headaches. And we do this all the time. The patient comes in, they say they have a headache, and this works great. We do 0.0, omega-2, Shen Men, Singulate Gyrus, and then we have, and I'll show you this in a second, the endpoint. We can do body points, large intestine 4, which is in the web here. Pericardium 6, which is right about there. That's that nausea point. Stomach 36, if you put your hand on your kneecap, on outside of the tibial bone where your ring finger lands, that's stomach 36. Stomach 43 is further on down the leg, and then livers 2, 3, and 4. And if we do an more acupuncture therapy classes, we will describe those. But you can look for stimulations on the feet, livers 2, 3, and 4 on the feet, between the first and second toes. And so for migraine headaches, this is our 0.0. This is the area of our omega here, and then we put the needle behind it and we go right into the scalp. So this is our omega, and we go right into the scalp right here, and that's your end point. To stop smoking, Shen Men, 0.0, and we're going to show you lungs 1 and 2, the nicotine point, TME, and kidney. So here's your 0.0, here's your Shen Men. We've seen these before. Lungs 1 and 2 are in the concha, and again, you can use a probe to find areas that are tender. The nicotine point is in front of the tragus here. And then TME, there's 2 of them, is directly below, halfway between the vermilion border and the nasal alveoli, directly 45 degrees from the center of the nostril. It'll be here and here. That's TME 1. And then there's a second one on the wrist, just above the proximal IP joint right here. That's the second one. There's another, this is the NADA protocol, which is used for, was one of the original drug and alcohol protocols that was developed in the 80s by Dr. Michael Smith in a New York hospital. And it uses a liver point, which again is in the concha here. You have to use a probe to find it. The lung point here, kidney point, which is under the area here, and Shen Men, and then sympathetic. So it's slightly different, but that's another protocol that has been used. 2 treatments a week for 30 minutes, 2 weeks total. After the second treatment, we ask the patient to start tapering their smoking, and we sometimes will add in a nicotine gum with that, but very rarely. Usually 4 treatments is all we need. Appetite control. So there's 3 points, your Shen Men 0.0, 15 minutes, and your appetite point. It helps suppress binging. Here is your appetite point right here, right in front of the auricular opening. There's your Shen Men in 0.0. And we need to diet with it, of course, some sort of diet. We like the mini fast, 2 meals within 8 hours, usually at 11 a.m. and 7 p.m. Exercise during the breakfast time area, or we can do a fasting mimicking diet, which is a program does a 5 days mini fast or fasting program every month. HCG, which utilizes human choriogonadotropin, 250. Some practitioners use 500 units, and a 500 to 800 calorie a day diet. And then there's, for cravings, we like diphenylalanine, 1 gram 4 times a day. For appetite control, there are medications. We can use phentermine and low dose fluoxetine with 10 milligrams a day. There's a commercial product which has naloxone and bupropion in it as a combination, which also helps with appetite control. And then there's some add-ons. We can do a keto paleo diet. We have that on in an online program. We have a herbal remedy which helps suppress leptin, glutathione intravenously once or twice a week, 600 milligrams. We've used successfully. B12 with methionine and inositol and choline, and we can do an elimination diet also. Allergies. So there's a number of points that we use for allergies. Remember, our omega-2 area is very good for allergies. And then under the helix here, especially for pruritus, is quite effective for allergy-like symptoms. And you can just feel along under the helix and find the area that's most tender. You can use your fingernail, and 15 to 30 seconds will help alleviate it, at least temporarily, usually 15 to 20 minutes. So there's the allergy point, Shenmen point, and point 0. Let's go back. Here's your allergy point. Again, the peak at the top of the helix, but it's underneath. It's not on top. It's underneath the fold. So it's under there. You can do that twice weekly. There's an intradermal needle we can place in a liver point, which you have to find with a probe, which is retained for 21 days. In the literature, this is known as Solomon's auricular acupuncture therapy for allergies, and we've used this quite effectively also. The liver in Chinese medicine is the nidus of allergies. It is the origination of mast cells, IgE antibodies, allergic reactions, and anaphylaxis. Long-term pathophysiological changes and tissue remodelings are associated with chronic allergic inflammation. Acquisition of new food allergies following liver transplantation is quite well known, and immunosuppressive drugs may be the etiology. Not seen in transplant-acquired food allergies are cardiac, pulmonary, or renal transplants. So it's the liver in Chinese medicine that is the area of our focus. We place the needle here, right in here in the probe. This is a flat needle with a little tiny head on it. This is the efficacy of it. There's the needle. We take a little forceps and we place the needle in the concha here. Then we take a small piece of tape and we put it under the head, put another piece on top of the head. In about an hour, the two pieces of tape seal, and we need them to stay in for 21 days. Frequently, the patients, they will come out. We have them come back, tell them to come back in as long as we're there. It only takes 15 to 30 seconds to put the needles back in. Most of the time, it's only a one-time repeat. We have to put the needles in. Although this season, I've had one patient come back 14 times in her 21 days. I think she liked just playing with the needles, or she had nothing better to do in our COVID lockdown. So we were a source of entertainment for her. This is the effectiveness of the allergy treatments. Nogés is the traditional ear auricular therapy, and this is the results from Solomon's allergy treatment. As you can see, it's quite effective, and we've used this for a long time, 20 years, with great effect. Sometimes we'll add in some quercetin and nettle, which are interleukin 1 and 6 antagonists. And between that and the Solomon's allergy needle treatment, we are quite successful and have decreased the amount of steroids we need in our patients, probably 80 to 90%. Again, there's the picture, there's the needles. For insomnia, there are 2 points here, insomnia 1 and 2. And then if no relief, again, we go to Shenmen and 0.0. And then if still no relief, we'll do body needles and then put our ASP needles in. And that's another way to do it. For vertigo, we put the needle straight down. So this is your tip of your needle goes in here in the antitragus, along with our Shenmen and 0.0. Do it bilaterally. For libido, we can turn you on here. Remember, it's pretty much in the anterior to the auricle, and we can turn you off. So here's our sexual desire point. Here's our sexual suppression point, known as Bosch and Jerome. And I don't know why they have those names. Maybe it was found by doctors Bosch and Jerome. I have no idea. But that's what they're labeled as. Use the Siren number 3 needles for 15 minutes, and then our ASP needles once or twice a week. For erectile dysfunction, again, the sexual desire point, Shenmen, and there's a point here. This is for external genitalia and the sexual desire point. For menstrual issues, again, on the anterior curve of the helix, external genitalia here, adrenal gland here, 0.0. This is known as the vitality point. Down here is a point for stimulating prolactin. Mammary glands are here, chest is in here, and abdomen. Quite frankly, we don't use these very often. Here again, here are our battlefield points. To reiterate, our main points: singulate gyrus. You start on the dominant hand side, go to the other side. If this is a right-handed person, this is their right ear. Go to singulate gyrus on the left. I would go to the thalamus on the left, thalamus on the right, omega 2 on the right, omega 2 on the left, Shenmen on the left, Shenmen on the right, 0.0, 0.0. This concludes our survey of battlefield acupuncture. And if need be, let me know, put it in the chat, and we can do some practical hands-on experience. Thank you, and have a great day.